since we started screening people for colon cancer, the incidence and mortality from colon cancer has dropped by about 40%, or a little bit more than 40% in the last 25 years. A huge success story. There is no other success story like it in the United States, or anywhere really. What can we do now to do better than we're doing? And that is we can apply screening to a larger portion of the population. So-called on-time screening, starting screening actually when the recommendations are that you should start. So for average risk individuals in the United States, the recommendation is to start screening at 50, or the American Cancer Society recently changed their recommendations to start at age 45. So start at age 45 or 50. If you look at the screening rates in the folks that are in the 50 to 55 or 55 to 59-year-old group, it's about 50%. Whereas if you look at the over 75 or the over 65 group, it's almost 80%. So on-time screening is one thing we can do. We can talk to people earlier about when they should start screening so that they know it's coming up, that we don't tell them on the day they're supposed to get screened that you need to get screened this year. It takes time to convince people that they really need to be screened. So if we started the conversation earlier than 45, say, we would give people time. If we decided that we were going to start at 45 or 50, we'd give people time to recognize that that's a recommendation that is serious, that it's important, give it time to discuss it, and get it done on time. So perhaps the most important thing we could do is on-time screening.